Hi everyone and welcome back to 5-Minute Medicine. This video will give you a brief overview of fibroids, also known as leiomyomas. So let's start with the basics. Fibroids are smooth muscle tumors of the uterus which are estrogen sensitive, meaning that they grow in response to the menstrual cycle. They're more commonly seen in Afro-Caribbean women and women over 30, and there are multiple types of fibroids, and I would like to discuss the main 4 types on this next slide. So the first one is an intramural fibroid, which you can see on the diagram here, and it grows within the myometrium, meaning that as it grows, it can change the shape and distort the uterus. The next one is a subserosal, which can be seen here, and it is found just below the outside layer of the uterus and can grow outwards, fill the abdominal cavity, and get rather big. The next one is a submucosal, which can be found just below the lining of the uterus, and a cervical one which can be found here. Other fibroids can be found throughout the uterus as well. Another one which isn't illustrated here is a pedunculated one, which would be found on a stalk, and it can be found either on the outside or inside the uterine cavity. In terms of clinical presentation, the main 3 complaints of patient would be abdominal pain, menstrual changes, and some systemic symptoms. The abdominal pain is in lower abdomen, and it is a cramping sensation which worsens in menstruation. The patient may also experience some bloating. The main menstrual change the patients normally come complaining of is menorrhagia, but prolonged menstruation may also be seen. Some of the main systemic symptoms are urinary frequency, dyspareunia, which is discomfort during sex, and subfertility. So the patient might be experiencing really heavy bleeding, some abdominal pain, and they've been trying to have a baby for a long time without success. So what are some of the investigations that can be done for fibroids? The first one is an ultrasound, and it is usually one of the first investigations to be done. Another one is an endometrial biopsy and a hysteroscopy. So the ultrasound helps visualize the fibroid, and it is diagnostic, and it shows the fibroid's location, number, and size. The biopsy helps differentiate a fibroid from something like a cancer, and therefore it should be normal and not show any cancerous cells in a patient with just a fibroid. Lastly, a hysteroscopy can be done, which can be seen here, where a thin tube is inserted into the uterus, and it is ideal for larger fibroids that present with very heavy bleeding. After a diagnosis of fibroids has been made, the management splits into 2 categories: for patients who desire to keep their fertility and for those who do not. If a patient desires to keep the fertility, one of the first management lines is the Mirena coil, and it is especially good for those with fibroids smaller than 3 centimeters. Another one is the combined oral contraceptive pill, and as well as NSAIDs and tranexamic acid can be used for symptoms of menorrhagia. Lastly, there is a surgical option for those who desire to keep the fertility, which is myomectomy, where a laparoscopic surgery is performed in order to remove the fibroids, and it has been shown that this surgery can improve fertility of those who undergo it. For those who do not desire to maintain fertility, uterine artery embolization can be done, which you can see here, where the blood supply is disrupted to the uterus and therefore also the fibroids. Or a hysterectomy can be performed, where the entire uterus together with the fibroids are removed. It is important to note that before surgery, GnRH agonists such as goserelin can be given to shrink the fibroids and prepare the patient for the surgery. Lastly, just a quick overview of red degeneration of fibroids. It occurs when ischemia and infection of a large fibroid happens in a patient, usually one that is pregnant, and that is due to the disrupted blood supply where the fibroid outgrows itself due to its response to the hormonal changes during a pregnancy. It is seen typically in the second half of pregnancy, especially the 2nd and 3rd trimester, and the patient has a key history of fibroids before being pregnant. The patient presents with abdominal pain, tachycardia, vomiting, and might also have some low-grade fever, but the management is supportive with fluids, etc. This was a very brief overview of fibroids. If you have any questions, please leave them down in the comments. But other than that, thank you so much for watching, and I'll see you later.